First of all, so circadian clock programs daily rhythms and coordinate multiple behavior and physiological processes, including micturition. In our previous study, long-term BOO, blood outlet obstruction, lead to disruption of the circadian rhythm in mice, similar to those observed in human as nocturia. In clinical setting, alpha-1 blocker relieve nocturia of BPH patient. However, the mechanism of this improvement is not completely clarified. So, we investigated the effects of chronic administration of alpha-1 blocker on micturition behavior as circadian rhythm of long-term BOO mice. And to clarify the mechanism, we focused on several growth factors and cytokines. So this is a method. We use the female black 6 mice, and we made a partial BOO using a tied with a metal rod. And we comparison 4 groups. This is intact and sham and partial BOO mice. And this is a different point. So these groups using a normal diet, and this diet mixed naftopigil alpha-1 blocker. And we tested 6 months. After 6 months, so we tested micturition parameters and messenger RNA expression level of such parameters. So this is a result. You can see here. This is an intact sham and partial BOO, and this is a administrated 6 months naftopigil. So the number of micturition is not significantly changed, almost the same micturition number. However, this represents the percentage of nighttime and daytime micturition number. So this rodent is a nocturnal animal. So after partial BOO, the percentage of daytime micturition is increased. This means this is a disruption of circadian rhythm. But after 6 months administration of naftopigil, this was relieved. And this is a result of messenger RNA level. So collagen and serotonin, 5-HT2A, and TIMP, such parameters are increased after partial BOO. And TIMP2 and serotonin 2A was significantly decreased after 6 months administration of alpha-1 blocker. So long-term administration of alpha-1 blocker reversed the micturition pattern in BOO mice. A group of enzyme, MMP, this is a specific inhibitor for fibrosis, and TIMP was also a critical factor of tissue fibrosis. Both TIMP1, 2 were increased after partial BOO, and then naftopigil reversed TIMP2 expression. In the current study, partial BOO induced increment of serotonin 2A, which change was reversed by long-term administration of naftopigil. So naftopigil has affinity not only alpha-1 blocker, but also this is a changing serotonin 2 antagonist. So partial BOO induced increment of serotonin 2A receptor, which change was reversed by long-term administration of naftopigil. This phenomenon could be the certain background mechanisms of relieving storage symptoms in BPH patients. However, long-term administration of naftopigil did not decrease the expression level of collagen 1 and 3. So actually, long-term effect of alpha-1 blocker could not induce a morphological change, but changing the functional change. So in conclusion, long-term administration of alpha-1 blocker reverses the micturition pattern in partial BOO mice. Naftopigil could modulate the expression of serotonin receptor and pathway of fibrogenesis. Thank you for your attention.
Thank you very much. We had earlier today a discussion about collagen RNA changes and not protein.
Yes.
And the explanation given to us was, well, 2 weeks was too short. You have done 6 months, so that excuse is off the table.
Okay.
You have now studied, on the one hand, collagen, but on the other hand, factors involved in making and breaking it down. And you see changes in those factors, but not of collagen itself. So if collagen itself doesn't change, why are these other factors relevant?
Yeah, that's a good point. So actually, so we maybe there are some factors, so including my material and method. So firstly, so I try to administrate naftopil every day, so per orally, but it's very tough work for us. So I just mixed naftopil into their CHO diet. So actually, so how many drugs into their body? It's very difficult to calculate it. So because the mice is a very small one, so every day we cannot check the decrease of the diet volume. So that's maybe it could be effect.
But in your mice, you know that your naftopil works because of your micturition pattern. So in that sense, I'm skeptical about that explanation. So if it was just in some mice the naftopil wasn't there enough, then you wouldn't have observed the change in the micturition pattern. So the micturition pattern data, if you believe them, shows all the naftopil you needed got into the system.
Yeah, I understand your meaning. So, yeah.
I don't doubt your data. It's just I'm not fully convinced by the explanation or interpretation why that happened.
Yeah. So actually, that is a very weak point of my experiment. So, so in clinical settings, so we feel that naftopil can relieve their storage symptoms, patient storage symptoms. But so that's including many factors, so they could change their behavior. So, but actually, I understand this is not completely explain my my experience. Yeah, I understand. So I have no idea.
So the effect of naftopil on micturition patterns, for example, could be an effect not happening in the bladder at all, but somewhere else in the body, including the brain, and indirectly, because circadian rhythms are regulated in the brain, not in the bladder. I hope.
Yeah, it's good. Yeah.
I have a question here. You write in your abstract that the effect of naftopil on BP8 symptoms was due to blockade of 5-HT2A. What is the basis for this? I mean, isn't that an alpha receptor mediated effect mainly? Because you find, I don't think that naftopil is better documented than silodicins, for example. So what is the reason? I mean, just because naftopil blocks a 5-HT receptor, that doesn't mean that this is the reason why they relieve BPH symptoms. Or do you agree?
Yeah, thank you for your question. So actually, so in only naftopil could change or modulate the serotonin 2A receptors. This is a previous report. We have previous report. And more, so after BPH, the muscle is changed. So in previous study, so the number of protein of serotonin 2A was increased. We have such previous data, so we choose the serotonin 2A. So
I think his question is not so much whether the receptor changes, but more how relevant this is for reducing BPH symptoms in patients.
I see. So, yeah, that's a good point. So, only naftopil can change the serotonin 2A receptor activity of serotonin 2A. So, actually, so I choose in this experiment only 5-HT2A receptors, but yeah, I'm not sure. So So, yeah, that could include the changing the relieving the symptom, storage symptom. Yeah, that I connect the reason of such mechanism from my experiments. Yeah, that's
Okay.
all. Yeah.
Please.
Saito from University of Pittsburgh. Thank you for your interesting study. I have a simple question. So, did you check their circadian rhythm, like when they sleep, what time they wake up? Because you said daytime and nighttime micturition. Are they awake longer because they have a lot of big bladder and a lot of discomfort? Did you check their circadian rhythm? And
Okay.
does naftophysiol like reduce, improve their circadian rhythm or bladder function? Which does this come from? Results.
Thank you for your question. So actually, my room is just at 12 hours daytime after 12 hours nighttime. That's all. So we just only check the metabolic cage, put in metabolic cage and check the number of the stain of urine. That's all. Actually, I did not check the moving. You just sleeping time. I did not check yet. Thank you for your point.
I mean, one point when you're talking about circadian rhythms, rats are nocturnal animals,
Yes.
which means whatever you observe during nighttime would be the equivalent of human daytime, and
Yeah.
vice versa.
Yeah, that's right.
Yeah.
Yeah.
Okay. Good. Thank you very much.
Thank you very much.